tear trough fillers, I often get asked about this area by people that come into the clinic, and nobody can ever pronounce how you say this. So I get a tear trough and lots of different variations on this, but it's basically like a trough that forms underneath the eye. And what happens, as you lose a bit of volume on the cheekbone and around about the orbital margin, which is the bone that surrounds the eye, the fat pads under the eye start to drop down. So you get this very characteristic groove starting to form underneath the eye, and also laterally at the side of the eye there. And you see this in almost everybody with age. Some people have a sort of predisposition to have this much earlier genetically. But there's a very simple solution to this. So using a bit of very lightweight dermal filler in this area, you can inject in the tear trough, which is this area here, and laterally around the orbital margin. And this just softens the whole area and decreases this hollowness that you get under the eyes with age. For people that don't want to have filler, there's a few other options that might improve this area, but less reliably so. So there's one called carboxytherapy, which is injections of carbon dioxide gas, and what that does is it stimulates collagen deposition in the skin, but you need to do probably about 10 treatments of that 1 week apart, so it's fairly labour intensive compared to filler, which is usually 1 or 2 treatments about a month apart. Or there is PRP. So PRP, you might have heard of the vampire facial or the Dracula facial. It's where you take blood, centrifuge it, then you isolate a portion of blood that is rich in plasma, which is contains thrombocytes, which are platelets. And when the platelets are injected under the eye, what they do is they release a lot of growth factors, which then stimulate collagen deposition in the area again. So it can kind of thicken the tissues around about that area with time. The results again are less reliable than filler, so always filler would be my kind of primary treatment, but for those of you who are really concerned about filler in that area, these might be another option. Also, you hear a lot about this area being treated and risks of filler in this area, but in reality, if you're going to a reputable practitioner who knows what they're doing and knows the anatomy of the area and are injecting in the right way, then the risks aren't any higher than that of filler elsewhere in the face. There's been a few headlines about this area being treated and causing blindness and things, but really that's because of inadequate knowledge of anatomy and inadequate knowledge of how to inject properly in this area. And it really is a tiny risk. So I personally am not concerned about this area more than injecting filler anywhere else in the face. So if you've got any questions about tear trough fillers or any fillers or any other treatments for elsewhere in the face, please don't hesitate to get in touch. My email address is info@drdavidjackclinic.com. Please subscribe to my channel, and if you've got any questions other than about this or any other treatments, please ask in the comments below, subscribe to my channel, and also turn on notifications.